Within mainstream service and commissioning, it is not uncommon to find consultants being brought into local communities to deliver community-related projects. Whilst this has its advantages, it has not always been sustainable. In Inner Northwest London Primary Care Trusts, we believe that one of the most effective ways of tackling health inequalities is by adequately resourcing and equipping local communities to improve their own health and well-being.
The Community Champions project initially started as a One London Health Champion program. The aim of Community Champions project is to actually kind of develop the capacity of local people so that they can deliver health promotion prevention activities, to train the existing champions to become, instead of just health champions, to become community champions.
I was able to do various activities and projects for local community to get involved. The project has boosted my confidence. It has given me new innovative way of coming up with new design, new project idea. It has given me the ability to be able to create some things from scratch at a grassroots level.
When we were first approached to get involved in this project, we were very aware that there were a number of health outcomes across the estate which were less than desirable. For instance, the north side of the estate had lower health outcomes than the south side of the estate, and the estate as a whole had poor health outcomes comparatively. We had a situation where rather than people from outside coming in, doing the work and taking away all the experience and benefits that they personally got from the project, we had a situation with local people receiving those benefits and remaining within the community to carry on doing similar kinds of work in future.
I've lived on this estate for more than 40 years. But why I'd done the Health Champions was to put something back into the community and hopefully stimulate the parents and the youngsters into a way of constructive thinking. I've learnt more teamwork, communication skills, and also it's given me the references to go out and apply for constructive work.
I myself am involved in health service provision, and there's always been a void between the health service and the communities that they are expected to serve, or that they do directly serve. It's very difficult for doctors, nurses, managers like myself to be able to get the views of the patients firsthand. We worked very closely with the health champions, and through that very close communication and the relationship that we established, we were able to understand the views of the community. We understood that they wanted women's only health clinics. We understood that they wanted respiratory services. I mean, also there's various bits of health information that doesn't always need a doctor or a nurse or a health professional. I mean, you know, having to increase compliance and concordance with treatments and campaigns and health promotion. I mean, who better would people from the community take than from other members of their own community?
I've lived in the estate almost 20 years. This project has been benefiting the community in a positive way for the fact that elderly people are not just stuck in their flats. They come out in doing dancing activities, and if these such projects are expanded to get the youths involved at any time when they are, when they want, I think it's a blessing for the community.
We believe some of the key benefits of this project is increasing employment opportunity uptake, increasing awareness of health promotion.
Yeah, I did learn a lot from the project, from the training. It was new, and then working as a health champion was an opportunity for me to get involved in the current job I'm doing now. And I think it's important for everyone to get involved in it, or to find job vacancies in the borough.
We have done a project in lung cancer, which we've done over 6 weeks with 20 health champion or community volunteers, and we have reached within that short period over 1,200 local people within Shepherd's Bush and White City.
I'm a resident of this beautiful community. When I looked out of my window when I parked in Newly, I saw a lot of dejected people, a lot of old people that seem isolated and sick. I thought I have to put something back to this community, and I had to sign up with the Community Champions project. We were trained quickly to carry out health promotion messages. We were signposting people, and people seem happy. participating in these projects. And we, the volunteers, also were giving empowered by various trainings. We were given employment opportunities. Most of us were employed, and it has been amazing.
The recognition of the success of this project enabled us to use it to contribute towards other bids, other projects. For instance, we now have received £1 million from the big lottery to spend in the area. Part of that is due to the fact that we have shown that by giving money to this community, we're able to deliver, and deliver really, really well. It's also given a lot of people the confidence to come forward and get involved in other projects. We've recently set up a neighbourhood forum. The neighbourhood forum is a different concept. Rather than everybody working in silos, we go to meetings, we discuss health. We go to meetings, we discuss education. We go to meetings, we discuss housing. We have everybody from all of the different sectors sitting around the same table discussing issues for the neighbourhood. It's important to recognise that the people within the community, they're very capable of delivering projects, they're very capable of controlling budgets, they're very capable of being in charge of facilities and making decisions about planning and other things. All of this confidence that exists within the community is due to projects like the Champions project.
I'm a local resident from White City, got involved in one of the programs that the Community Champions was involved in and become an activator, community activator. Loved what it was about, exercise. As you can see, I'm doing my physical activity from that because now I'm a Zumba instructor, doing it and loving it, and it's activating the community, as you can see behind me, which is fantastic.
In terms of what next, the Champions have already been involved in the recruitment of new volunteers, and so far they've been successful in recruiting 39 new people across Hammersmith and Fulham who are engaged and quite excited about being involved. We also have plans for scoping and identifying the potential for upscaling the model across Hammersmith and Fulham down to the south of the borough, but also looking at the other neighbouring boroughs. So for us, the investment in the local communities have not only helped us deliver on our public health targets, it's also helped us promote mental health and well-being and social regeneration of the area, which from my perspective are all key public health targets and outcomes.